pain, tingling, or numbness. Maybe it goes into your shoulder. For some of you, it might go all the way down your arm, and for others, maybe in between your shoulder blades by your rhomboid or scapula. In this video, I'm going to show you a 90-second fix to that pain, numbness, or tingling in the comfort of your home. It's safe, effective, and you don't need any special equipment. Let's get to it. I want you to follow along with me so you can start to feel relief immediately in the first 90 seconds that we do this. The first thing we're going to do is find the trigger points. Take these 4 fingers, place them on the back of your neck, like this, and we're going to fall along these muscles to try to find, let's pretend your pinched nerve is on the right. You're going to find the trigger point definitely either in these muscles, or some of you it might be the upper traps, but let's focus on finding, there's one right there. I'm going to take 2 of my fingers or 1, and we're going to find that and gently massage that in a circular motion. For some of you, you might want to keep just the pressure there. This is going to be for about 30 seconds or so. Again, let's assume it's the right sided pinched nerve. You're going to search along these scalenes. You might come back here to the suboccipital area at the very top. There's another one. So for some of you, you might have 1 or 2, but you got to seek out where that trigger point is. A little bit lower, maybe in the upper trap. There's another little one for me. I'm going to hold this, as I say, for 15 to 30 seconds. You can do both sides, but here the best thing to do is focus on the side of the irritated nerve. Hold it for, like I said, 15 to 30 seconds. Common areas are going to be one of 3 spots. The suboccipital up here, underneath the skull, these scalenes in the middle part of the neck, or typically in the bottom part right by the upper trap, or again where those scalenes attach to the top few ribs. Those are going to be your go-to points. You need to find those first, release them, and now we're going to get to the next effective thing, is stretching out the area. The next movement is a stretch. It's trying to open up the space where those nerves exit the neck and move into the shoulder blade area or down the arm. This one is simple, but there's some subtle things you need to pay attention to. The very first thing we're going to do, again, we're going to assume it's on the right side. We're slowly going to lift. It's not going to be a full chin tuck. It's going to be more of a tilt down, and visualize your head coming up. The same side, or the affected arm or shoulder blade, we're going to come behind our back. Let me show you. So we're going to tilt up, visualize our head being pulled up, come behind the back, and then we're going to tilt away from the irritated nerve. This is where you have to play around a little bit to find out where the best stretch is for you. So chin up, visualize a rope being pulled, arm behind. We're going to come away as we pull the shoulder down. Now here's the thing. Some of you might feel more relief when you look up, while others may feel more relief when you look slightly down. Depending on what nerve and what muscles are involved, that's going to be dependent whether you go down or up. But it doesn't matter. The key is finding the right movement for you. Again, remember, visualize up, pull, and either up this way and hold for 30 seconds, or some of you may be down a little bit. You're going to feel the nerve refer into the area when you get the right spot. Now, here's the thing. You don't want to push it too hard, but you want to push it enough that you feel it. It won't be virtually pain-free, but it should not be excruciating either. It should be about a 4 to 5 out of 10. And some of you that are experiencing a pinched nerve might have a 10 out of 10, so you understand what that means. So the key here is not pushing too hard. You want to be stretching enough that you're actually opening up the space. Let's just show you from the other side. Let's pretend it's left-sided now. So again, sit straight up, chin slightly elevated, tucked, but pulling up, visualizing. Arm goes behind the back, drop the shoulder down, and we're going to tilt away. This might be enough for you. If it's not, then you're going to rotate either up slightly or down. Again, always visualizing your head being pulled by a string. It's going to take the space between those muscles and open up to help provide some relief to those nerves that are irritated or pinched. Stay with me. The last thing might be the most effective for you. We're going to show you a very simple, easy, but really effective nerve glide or floss. Let's get right into the nerve glide. The nerve glide or nerve floss, what it does a few things. It removes adhesions along the path of the nerve. It can help desensitize and make the nerve not feel as much pain, and it helps blood flow so the nerve can heal. This one's simple. Stand up or sit nice and tall. Engage your shoulder blades slightly. We're going to have our hand pointed down on the affected side. The opposite hand is going to be pointing up. We're going to start with looking at the affected side, and all we're going to do is we're going to rotate. As we rotate, we're going to flip the hands. And we're going to do this nice and slow. Work to your tolerance. So you might not be able to get your hand all the way because the nerve is under such tension. That's okay. Just work to your tolerance. And you can do this movement for 30 seconds as well. The great thing about this, it's very little movement. Most people can handle it based on the severity of their discomfort. It doesn't take long, and it can be done multiple times a day. Nice and slow and controlled, really causing some nerve glide and flossing. Here's the thing, I want you to do this as a routine. So let me just quickly summarize. Each component takes 30 seconds. The first one, find the trigger point, either in your suboccipitals, your middle part of your neck, or your upper traps. They're the most common areas that you're gonna find. How you know you have one? It's tender, it might refer out from that spot. Hold the pressure point or massage it in a circular motion for about 30 seconds. Right away after that, we're going to go right into our decompression stretch. That's going to be, like we said, the same side. We're going to pull our chin up and back. Visualize this where your head's being pulled up, not a chin tucked directly. And as we do that, we'll take our arm behind our back. We're going to drop our shoulder down and we're going to bend away. Now for some of you, you're going to be stretching up. Others, you'll be looking down. Find what works for you. Everybody's a bit different. Every nerve's a bit different. Every part of the nerve's a bit different. So you got to experiment a little bit. I know you're going to find the one that works for you. And then finally, 30 seconds again. So we get 30, 60, 90 seconds to immediate relief. You're going to start this, do this daily, work up to 1 to 3 times a day. And I know you're going to feel some relief within the first time you do it, and the longer you do it, the more effective it will become. Let me know what you like best in the comments below. Thanks for tuning in. If you're new to my channel, maybe you'll consider subscribing so you can be informed when I upload a new video. If you want a little more connection with me, a little more input on what goes on to the channel, maybe you'll consider joining our membership as well. If you want more in-depth videos on how to fix a pinched nerve in your neck, one of these 2 videos for you. We just talk a little bit more in detail about the 3 nerves in your arms with more specific advice. Again, thanks for tuning in. I can't wait to see you in my next video. Until then, stay well.